What is Nivi?
Nivi is a patient engagement platform. It's registered in Kenya, Ask
Mm-hmm.
Nivi Private Limited,
Yes.
or Ask Nivi Limited in Kenya.
Menstrual hygiene is a basic human right.
There's no story without numbers.
Youth economic empowerment is one of the foundations of sustainable change.
Let's talk.
Let's talk.
Let's talk.
One-to-one cafe.
So, hello and welcome to another episode with the One-to-One Cafe. And with me, we have a special guest. Yay! Dr. Ben! Yes, clapping. Welcome. Thank you very much for coming here. Maybe you can tell the audience who you are and where you're coming from.
Great. Well, I'm excited to be here. Ben Bellows. I'm one of the co-founders and the chief business officer at Nivi. So my background, I trained as an epidemiologist. Although I have this commercial role now
Yes.
at Nivi, my background's in public health. And so pretty excited to be able to make public health and business come together.
Well, public health really does need the business to come together, and we'll get in touch talking about that when you're talking about different opportunities, especially when it comes to digital health. So, what is Nivi?
Nivi is a patient engagement platform. We aim to reach, understand, and serve different consumer and patient populations, really helping them understand their own health goals, to drive on their own health priorities, and in some cases, help them discover what those priorities may be.
Yeah.
We work with organizations. They could be for-profit, not-for-profit, even public sector. And in partnering with these organizations, we help reach their target audiences. So I think working together can really unlock a lot of agency for individuals across a wide swath of the population.
Yeah, and I think that's something that we have in common between LVCT Health and Ask Nivi, in that we want to be able to encourage the populations to have, take control
Yep.
of themselves and take control of their health. And working with different people, I'm sure must be very interesting, especially when you move away from non-profit and go into for-profit or public sector. It's very interesting just working with the different people and how they think and how we need to be able to put our message across as to why it's important to have this. So maybe you can give a brief of how you would do that, because the messaging for
Yeah,
non-profit is not the messaging you'd give a for-profit. So could you give a brief of that?
I'd be glad to. There's a bit of an origin story in that
Yeah.
question too. Our our current business model, if you will, this B to B to C model, really grows out of some experience several of us had prior to Nivi.
Yeah.
Early on, this is 2011. I was here in Nairobi with Population Council, and we were awarded a Saving Lives at Birth grant. So our nonprofit research institute, we had this money to go out and build a technical solution. It was going to be an SMS-based solution to help pregnant women self-identify risk or high-risk moments in pregnancy. And it worked well. We built it, deployed it, tested it, compared to what a nurse would determine at intake at Jacaranda.
Yeah.
It was comparable in many ways. In fact, on some mental health indicators, it was a bit better. It seemed that women were more comfortable confiding in the phone around stress
Yeah.
related to pregnancy than they were talking to the nurse. But at the end of those 2 years, we had something that worked, and we had to write a nice report
Yep.
and shelve it. That was
Yeah.
it.
Yeah.
So it was a bit of an awakening or a moment realizing that we needed something more sustainable that could drive a technical solution forward.
Yeah, yeah, and I think that's something that's very common, especially when it comes to nonprofit, that you see it working so well in the community, and then when the funds go, you're like, gosh, how can we be able to push this through? So that's really interesting and really great that if this is where it was born from, then it does show that the work that nonprofits do is really important.
It is.
And we need to push for more sustainability. So could you continue with how then Ask Nivi was born and came into Kenya?
Well, it was, there were some follow-on conversations. There were other funders, particularly MSD from others, that was, they were intrigued. This idea of having a triage tool, a self-screening tool, something available on a phone, something that could be distributed to whoever had a phone.
Yeah.
And the conversation shifted into what can you do around family planning or contraceptive counseling. At the same time, I'd run into an entrepreneur in residence, a guy out of Boston who's a serial entrepreneur, software engineer. And so the two of us sat down, had a conversation, and realized there's an opportunity here, a need. And if we can help individuals, women, we were thinking initially around contraception particularly, help decisions be made, help discover which methods are appropriate and where to find those methods, that there could be a business model
Yeah.
in that. And so that was really the moment, the genesis story for Nivi, realizing let's wrap a business model around this to help organizations solve for their priority population's needs. And that was in 2016 we
Yeah.
registered the company.
In Kenya?
It's registered in Kenya, Ask Nivi Private Limited,
Yes.
or Ask Nivi Limited in Kenya. We also have a U.S. Parent company out of Boston, and then we also have, jumping ahead a bit here,
Yes.
but presence in other countries. We
Yeah.
stood up in Nigeria in 2020, in India about the same time, maybe early 2019,
Yeah.
and then more recently expanded into Thailand, Indonesia, and then next door in Uganda.
Yay.
So
Great.
we're growing.
Yeah, your footprint is growing, steadily growing, and just hoping that it can be, as successful as in Kenya. Humble
Yes.
brag. But that's so interesting. So, what do you think about like the digital health ecosystem? What is the reception with others? What can we do better here, especially now since we're in Kenya?
Kenya's been at the forefront in digital innovation, right? Some of it's driven by necessity, some of it's driven by opportunity. I think there's a real entrepreneurial mindset in Kenya that sometimes being here, we sometimes don't appreciate how
Yeah.
entrepreneurial that is.
Oh, yeah.
And having worked in a few other places, I'm not that young anymore. And,
You look young.
well, Nairobi brings it out.
Yes.
But in my experience, seeing how driven many people are here to make a go of
Yeah.
things, and it's really speaks well to and works well in the digital ecosystem here in the Silicon Savannah. And I've seen a lot of build out when it comes to health on the supply side, innovation in supply chain, stock management, best business practices, quality improvement, clinics, pharmacies, hospitals. There's still a space, though, I think, on the patient engagement side,
Yeah.
an opportunity to help individuals better understand where they're at vis-a-vis their own health goals and ways in which they can achieve those health goals that may involve the health system, may involve behavior change or
Yeah.
behavior modification at home, or somewhere in between.
Yeah.
And so our solution operates in that space. I think there are others that are also entering into that patient engagement ecosystem, but that's really where I see the next stage
Yeah.
for digital evolution in the public health space is really
Yeah.
centering on the individual.
Yes, and it's very important. We were speaking before we started to film, talking about just having that self-determination, encouraging the individual to have that self-determination, and I think having the options there are important. But what do you do about accessibility? Because we know that you mentioned Silicon Savannah. Kenya is known as the Silicon Savannah. We have a high mobile penetration, for example. What do you do about accessibility? And I'm talking about devices, and I'm also talking about even for persons with disability.
I think there's real value in thinking about complementarities.
Yes.
Government's done a really good job of well, we're seeing now in several different directions advances on UHC and bringing the newly renovated social health insurance models to communities across the country and seeing uptake of social health insurance coverage. We're seeing deployment of community health workers at large scale, tens of thousands, into communities that need that sort of lay health perspective, that community-based perspective. All of these are moments and means to expand opportunity, ultimately empowering policyholders
Yeah.
with the means to buy or pay for healthcare. Community health workers to activate that interest and that intent to take action. Adding a digital layer, a durable navigation layer that can support behavior change, can support awareness, to activating intent and activating readiness to take action and helping someone then ultimately access care is another important dimension to consider. Universal access, we're not quite there yet with not everyone having a smartphone in hand.
Yeah.
There may be a lack of data bundles or lack of network. Things happen. But being able to reach more of the population with this ability to self-activate, self-support, and guide oneself into the health system and back home and again as needed for adherence on particular health topics, that alleviates, that allows some of the health system to then focus on those who do not have. So it's about how do you rationalize, how do you help people take the next step for those that have the means to do so, such so that CHWs and others can then focus on those who may not have digital access right now. It's moving us forward in a way that drives an opportunity for those that have the means to access it.
Yeah. And it's also very important for us as we're doing. You mentioned working with the CHWs, that's community health workers, and they just complement whatever is going on digitally. And I think for us, we work with any phone, so-called kabambes, because if you don't have a smartphone yet, probably at least have access to a kabambe, and you just need the line to be working for you to be able to call for free or text for free. And I think those are some of the solutions you were alluding to that are there, and working with working now with community health workers is very important, because still, even if we can get to somebody with a kabambe, they still need that human connection. Because then maybe you'll find out with somebody probably who is illiterate, or they just probably haven't really heard of the service. How then can you bridge that gap? It's a very interesting thing to talk about and see. But then maybe we can speak more about like partnerships and even what we're trying to do right now with the new innovations that are coming along. Is there anything that you're very excited about?
Well, you mentioned partnerships,
Yeah.
mentioned innovation. The way we like to work is play to our relative strengths, our comparative advantages. And what we'll offer is that ability to engage consumers, to activate intent and reach people cost effectively at scale on multiple health domains, or you were talking earlier about flows,
Yes.
these sort of journeys that one takes on a health priority. So for us, it's important to be able to do what we do well, and then partner with organizations that can complement what we're doing with their own strengths. So when you think about partnering with maybe county government, they have many CHVs or CHWs, community health workers, that are going out, serving the people, and they can introduce, in the course of going house to house, introduce a chatbot that's available to answer questions once that conversation has come to an end. So this is an opportunity to play to our relative strengths. We're there when the CHW isn't necessarily, or after that radio program is ended, the message is resonating in their head, they have some follow-up questions, well, they can ask Nivi. And likewise with the work that LVCT is doing around HIV awareness and guidance into care, you've got a contact center. You have agents that are available over certain hours, and there's an opportunity for us to, if someone's looking for that human voice and a way to connect, we can refer into LVCT. Together, we can work with counties, with NASCOP, and with the Ministry of Health here at national level to think about what it means to generate awareness around HIV prevention strategies, helping individuals who may be at risk understand the risk, uh, individuals who are in need or eligible for breakthrough therapeutics like lenacapavir, being able to discover which facilities in these 15 high-burden counties now will be stocking lenacapavir. So helping individuals on, if you will, the demand side, connect to the supply side, connect to stocks that are available now at health facilities. And I think that sort of partnership speaks to our strengths.
Yeah. So you mentioned lenacapavir.
Yeah.
Maybe you can just tell us what is this lenacapavir? I think, especially for those who've heard about it and probably haven't gotten a firm grasp of it. What is it and how does it work?
Well, it's an amazing drug. It's another option in the armament, if you will, or pharmacopoeia of solutions available to prevent HIV
Yeah.
infection. So as a pre-exposure prophylaxis, it's useful in preventing HIV infection. It's another option. There are pills and other injectables out there for shorter duration. Lenacapavir is unique in that it seems to be preventing, or studies have documented, that it can be effective up to 6 months in preventing HIV infection. Certain studies conducted in South Africa and Uganda showed up to 100% efficacy in preventing HIV infection in the study populations. It's an injectable, and so there's a screening process to understand HIV risk and eligibility. Once one connects with the provider and understands which facilities are stocking it, go in, get the initial dosage, and then follow up every 6 months to remain HIV free. So it's an amazing new option that was just launched in Kenya last week, and will continue to be part of that comprehensive HIV response.
Yeah, I really love that now we have the choice, and it's very important to just continue talking about it and educating the public on these different choices. So just to cap, we have the oral, which is the pill, right? We have the dapivirine, which is so the pill can be taken by anybody who's at risk. Then we have the dapivirine ring, which can only be used by women, and it's inserted as one would insert a tampon. The instructions there and everything. Which is the other one?
It's a 2-month
Yes. Yeah.
injectable.
Yes, there's a 2-month injectable, and then we have the lenacapavir, which is 6 months. So I think it's really important for us to also let people know that we have the choice when it comes to HIV prevention, which is one of our priorities. We're talking about no new HIV infections in 2030. We're in 2026, and so we need to step up our efforts as we're seeing HIV infections are rising.
Since 2024, they've
yeah.
been ticking up. They're now 20,000, estimate 20,000 infections
Yeah.
a year in country. And to address that effectively, meeting people where they're at is critically important. And so solutions that can be available where people are, when they're ready to explore that information and learn more about it are incredibly important. So a
Yeah.
durable navigation layer, again, as a solution available to people at home, in the community, is incredibly important to help counsel and decide, as you were just describing, prep choice, helping individuals understand what their options are, explaining or asking them even questions about
Yep.
what their life needs are and priorities, and helping them land on the most relevant prep option.
Yeah, and understanding the risk. We were having a conversation about risk, and I think that's also part of the thing that we really need to do and help people understand what risk actually is. And that could be another whole conversation for another
Yeah.
another day. But I just think it was important for us to discuss that because it's the topic of the day, of discussion of the day, and just have that proper information about lenacapavir out there that people are seeing, and also to dispel some of the misinformation and untruths that I saw out there. So it's a HIV prevention method. It is not a vaccine. Yeah, so that's just something that I wanted to put out there. So that's interesting. So Ask Nivi is helping to give this sexual reproductive health information. Who is your target audience, really? We didn't talk about that.
No, it's a good question. Given our sort of origin story, we started a lot around reproductive health, sexual health information. So we were reaching younger segments of the population, individuals, youth, young women who were and are curious, have questions, want to learn more. But we've also amplified our reach. We use different partnerships and different means to engage individuals through these communication channels. So we will and have partnered with community health volunteers or community health workers in different contexts. In Nigeria, we had a very significant partnership in Lagos to improve uptake of vaccines, routine immunization, and HPV vaccine, working with community health workers. In Kenya, we've partnered with IPASS, with Population Services Kenya, with Mari Stopes, Kasha, Maidawa, with MSD Pharmaceuticals, looking at insights around the HPV vaccine, which is another wonderful way to avoid or prevent up to 6 cancers with one shot. So working with different partners in country, always with public sector in mind, aligned with what Ministry of Health needs, priorities are for population health, and working with the counties, it's been really important. But yeah, we look to drive forward on the next big challenge, and we do this by reaching different consumer segments. So being available to people where and when they need it is really important for us.
It's very, very important to meet the user, as we call them, at the place of need. So I think that's really important. You mentioned the HPV vaccine. I think that's another thing that has been a hot topic. And it's really great that you're working with those different partners who are also well known and have their strengths to be able to just educate the people out there. Any parting shots that you have for us?
Well, we're really excited to see what comes next.
Yes.
With the rollout of lenacapavir in particular, I think in the HIV space, there's a lot of interest and momentum, and being able to really bend the curve on the HIV epidemic and slowing the rates of incidence. I mean, this 2030 goal is coming up, as you just mentioned, a few years ahead. So we're excited to partner with the stakeholders from national government, NASCOP, counties, and civil society to see this.
Yeah, I think we need to step up our efforts when it comes to just speaking about it. Sometimes in circles that I go, we talk about HIV fatigue. But I usually say, is the fatigue really? I think it's us, the practitioners, who are tired of talking about it. But when you go out there, when you speak to your little cab driver or your Uber driver, and you tell them about lenacapavir, for example, or even the oral PrEP, they're very excited about it because they're like, oh, sikujua kitu kama hiyo iko. I didn't know. So I think it's us, the practitioners, who have the fatigue, because we've been talking about it for the past 20 years. We probably need to step up the way we used to have Kibaki and the religious leaders holding their hands and whatever and doing those things. We need to go back to that kind of messaging and see how we can be able to really educate the public when it comes to HIV prevention and the different prevention methods and the choices that we have considering our lifestyles. So thank you so much for stopping by. We look forward to seeing you again. I think there's still more we can talk about. But we really appreciate you, Dr. Ben, or Ben as he told me to call him. I have been your host, Michelle, as usual. Thank you so much for watching this episode, and we'll see you on the next one.